Docusate sodium is a medication used to treat occasional constipation. It is often the first method used for preventing and treating this type of constipation. This medication is also used when straining to have a bowel movement should be avoided, such as after a heart attack or surgery. Docusate sodium works by increasing the amount of water the stool absorbs in the gut, making the stool softer and easier to pass. Relief is usually seen in 1 to 3 days with this medication. It's important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. The recommended daily dosage and optimal timing for taking this medication should be discussed with a healthcare professional. When taking Docusate sodium, it's important to follow the directions on the product package. If you have any questions, consult your pharmacist or doctor. Typically, this medication is taken by mouth at bedtime with a full glass of water or juice. The dosage will depend on your medical condition, age, and how you respond to the treatment. If you're using the liquid form, be sure to measure the dose carefully and avoid using a household spoon. It's best to mix the syrup, liquid, or drops in juice, milk, or infant formula to prevent throat irritation and mask any bitter taste. Remember to only use this medication when needed and not for more than 1 week unless directed by your doctor. Avoid increasing your dose or taking it more often or for longer than directed, as this can increase your risk of side effects. If your condition doesn't improve or gets worse, seek medical help right away. Some common side effects of Docusate sodium may include stomach pain, diarrhea, cramping, or an irritated throat. If these effects persist or worsen, notify your doctor or pharmacist. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as rectal bleeding or signs of a serious allergic reaction, including rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects. If you notice any other effects, be sure to consult your doctor or pharmacist. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions. If you have any concerns or questions about the medication, don't hesitate to reach out to your healthcare provider. Before taking Docusate, make sure to consult your doctor or pharmacist if you have any allergies or if you are experiencing severe abdominal pain, nausea, vomiting, or a sudden change in bowel habits. It's important to inform your doctor about all the medications and herbal products you are using, especially before having surgery. If you are pregnant or breastfeeding, talk to your doctor before using this medication. Docusate sodium is used to treat constipation and to prevent straining during bowel movements. It is usually taken by mouth, with a full glass of water. The dosage is based on your medical condition and response to treatment. It is best to take this medication at bedtime or as directed by your doctor. Be sure to follow your doctor's instructions carefully. When taking Docusate sodium, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. This will help them determine if there are any potential interactions with Docusate sodium. It's also important not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Docusate sodium is mineral oil, so it's important to discuss all the medications and products you are using with your healthcare providers. If someone has taken too much Docusate sodium and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It is important not to share this medication with others. Make sure to keep all medical and lab appointments. Docusate sodium is used for the temporary relief of constipation. It is important to eat dietary fiber, drink enough water, and exercise to prevent constipation. It is not recommended to use this medication for a long period of time to prevent becoming dependent on laxatives. The daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. If you happen to forget a dose of Docusate Sodium, take it as soon as you remember. If it's almost time for your next dose, it's best to just skip the missed one and take the next dose at the regular time. Avoid doubling up on doses to make up for the missed one. When it comes to Docusate Sodium, it's important to store it at room temperature, away from light and moisture. Make sure not to store it in the bathroom, and always keep it out of reach of children and pets. Remember not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, it's crucial to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.